Okay, the last item, I think originally was intended for action on your part, but has evolved over the last couple of days, and that's the offer for providing data on coronavirus positive results from the Pennsylvania Department of Health. There's a lot of interest and intrigue over that data to be provided at various different levels. The Department of Health on Saturday, the Secretary of Department of Health sent a letter to all counties saying that the data for positive cases could be provided to counties exclusively for the use of the 911 center in warning or informing responding ambulances and police that a positive case has existed at the address that they're responding. And I'll only go so far with this and leave Director Dowd and Solicitor Warner to maybe shed a little more light on it. But there are some controversy over it by other counties. Other counties are saying it's not very useful, and so the non-disclosure agreement that the state is requiring each county to sign has some liability for the counties in it, and maybe it's not worth the liability for the data to be provided because first responders are already taking those precautions at every call, and whether or not there's a positive case at the address they're responding to, does that really make a difference? So that's just sort of to tee it up a little bit. I think initially it just looked like this was a no-brainer for everybody to sign on with, but it's evolved a little bit and maybe used as some leverage to try to gain a little more data from the Department of Health. So I don't know who wants to take it from there.
Yeah, I would agree. The short summary and takeaway there is we do not believe the potential value of the data that the state could provide us is greater than or has more value to us as a county and as first responders than the potential punishments and damages and liabilities that we would take on by accepting this data, and then frankly by using it, by distributing it out to the people and first responders who need the information. Just that distribution by itself, potentially, one could argue, opens us up to liability. So, and again, this is an opinion that is shared by solicitors across the state, by emergency management officials across the state, Bob Dowd's peers. So it really seems like something that needs a revision and needs to be changed. And our county association is working on doing that right now. So again, in short version, without going into every single detail of the agreement, it does not appear like there's a significant value, and it does appear like there is a great risk of liability potential for the county. So at this time, it's our recommendation not to take action on it.
Thank you.
Director Dowd, do you have any comment?
I looking over the guidelines and how we're supposed to disseminate this data and some of the requirements. I don't know that we can meet these requirements adequately to avoid being penalized, and the damages are significant. If we were, for each case, it's $5,000 fine. They could revoke 911 funding. The list goes on. So I think that there needs to be a revision of how this data is disseminated before we accept it. How this data is able to be disseminated.
All right. Is there any?
No, I opposed this from the first time I read it. Not only the liability issue, but just the mere fact that the state would pressure us essentially to sign an agreement like this, which, as has been indicated, is almost impossible to uphold. And I took the liberty to call Jeffrey Boyle, who was the signer of that letter, to tell him that I didn't think, because, as was indicated, our first responders are prepared to meet these needs in every case, and they wouldn't necessarily have to have a significant warning that this might be a coronavirus incident that they're responding to. But that we were, I think the public is entitled to information of how many of the positives were, from what municipalities do these come? I think that's general knowledge that the residents of the county, not just our county, every county is entitled to, because that allows you to make decisions about your own health and safety in our overall community. So I encouraged him to do that. He indicated to me that he agreed with me, thought that was so, and that information might be forthcoming in the next few days. So I think that would be far more valuable. And to me, I'm personally insulted by the fact that the state, the administration takes the cavalier attitude that they do on many of these issues related to this virus and this pandemic. So it doesn't give me a warm, fuzzy feeling. You know, the legislature took action in the last 2 days to move forward with opening up the economy. And it seems like in retribution, there's a letter from the Secretary of Health indicating that, we're going to add more onus to the small business owners, those that are open. So, and I begin to wonder whether it's the governor that's really running the state or whether it's Rachel Levine. So I don't have a real warm, fuzzy feeling about what's happening.
Wow. I do have some comments. I think that when we look at this, the recommendation from our solicitor is spot on. But I also wanted to take this opportunity to thank Bob Dowd and his staff and our GIS staff for creating a map on their webpage that shows us exactly where the deaths have occurred. And I understand there were 3. One was in Swatara, Bethel, and Lebanon City. And so if indeed that information Commissioner Ames was talking about is forthcoming, that we have where the 300 and some odd people have been infected, then that could be added to those layers, perhaps in a different color. But I find it very useful, again, in making personal decisions. And I want to commend Bob Dowd and Cherie Prentice-Brown and Jamie Wolgemuth for working together to make that happen. Thank you.
Dr. Yoakum.
And Dr. Yoakum. Okay.
I was going to make Bob, go ahead.
Yeah, Dr. Yoakum is the one who provided us that data and allowed us to release it.
Thank you.
Sounds like the pleasure of the board is that we don't let them fine tune it more and bring it back for another look at this point. Is that the pleasure of the board?
Yes.
Okay.
Mr. Chairman, if I may make one more comment, it's worth noting just so that there's an understanding of what this data is. It's not a complete data set and never will be. The state has been encouraging people, if you're sick, to stay home. And because of that, there are plenty of people who have probably had coronavirus or have it currently and are doing just that, staying home. Because of that, they're not going to show up in any of these databases, and that's okay. But putting this out there as some sort of complete set is very inaccurate. And I think
But it's a pattern. It's a pattern.
It certainly can. It can do statistical, analysis. You can do that with it, but it's the intent of the data is only to notify first responders in the form that was put out, and it is not a complete data set for that reason.
All right. Jamie, do you have anything else, or we want to have some comment from Bob Dowd, just to any updates that you might have for us, Bob?
Yeah, sure. That's good. Start with Bob, and I can give a few other, updates on some of our 24/7 operations and so on.
Okay, excellent.
Currently, our EOC is still maintaining level 3 activation.
Do you want to just mention what that is for the public?
Sure. Level 3 activation, there are several different tiers. Level 4 being daily operations, business as usual. Level 3 being the EOC is officially activated and we have resources dedicated specifically to our needs.
And the letters mean what?
Level, sorry.
Not the letter.
EOC.
Oh, gotcha. Now I'm tracking. Emergency Operations Center. Yeah, I apologize.
All right.
I live in a world of acronyms and I forget that. Yeah, so our Emergency Operations Center, which is the focal point for the county to manage any major situation. It's what the EOC's job is. The EOC is currently focused on collecting, consolidating, and then disseminating information. One of the big problems that we're seeing, especially from the state, is just a fragmented blast of information coming from multiple different state entities, and we're trying very hard to get that into something short and meaningful that we then disseminate out to our stakeholders in the community, being first responders and healthcare facilities. Another thing that we're working on is PPE supply requests. That continues. We're currently supporting first responders and healthcare workers first and foremost. We're also working with some long-term care facilities on a case-by-case basis. Part of what we're doing is helping educate how to conserve, reuse, and make sure everybody has current guidelines on how PPE should be used just to make it last, because the shortages at this point are not going away. Yesterday, the governor ordered or greatly expanded the required mask order. That now includes all essential staff. I'm sure that's going to expand our PPE distribution model in some way. I'm not entirely sure what that's going to look like at this point, but it's definitely going to change things. Our 911 center continues to see very, very low call volume. No significant trends of any kind that we're seeing. I know some counties are reporting higher sick person type of calls, but we have not seen any significant trends. Our PPE donations are continuing. It's been excellent. We've received a considerable amount of PPE, and one of the most important things for us at this point is masks. We have a lot of gloves. We're in pretty good shape there. Masks are the top, especially commercially made masks, and then cleaning supplies are also very, very useful.
Bob,
Yes.
you said especially the commercially made. Are you now accepting non-commercially made masks?
We're not, and I should have clarified that, because the masks that we're using, we're rolling out with specific guidance. We're only accepting commercially made masks, but there is lots of use for those homemade masks.
Yes.
When you consider the intent of the everybody wear a mask order that what came out last week, is basically to stop you from spreading it. You know, you're not protecting yourself from other people as much as you are protecting other people from you. And even something as simple as pulling your shirt up over your face, if you're near somebody, achieves that. So those homemade masks are excellent for that. We're not distributing those because we're working directly with the first responders at this point, and we're trying to get them the equipment they need when they're dealing with COVID positive patients, which is a different set of equipment. Just to close it up with a set of numbers, currently there are 349 cases confirmed in Lebanon County. The testing is starting to come back a little bit quicker, we're being told. However, there's still a significant delay from the time the state gets that to the time it gets released. We get it at the same time the state gets it, or the state releases it. Currently 3 deaths being tracked. Commissioner Litz talked about that for a little bit. Our numbers are going to be a little bit different than the state's. The state is tracking 2 currently, and as far as I understand, that's once again just the delay in their system. Once it gets through all the proper channels, then the state's numbers will be the same as ours. An important note on the map, that public map that's currently available on our website, it does show deaths. It puts a dot in the municipalities. That dot just indicates the municipality of deceased, does not indicate the actual physical location. And that's all I have.
Okay, Robert, thank you. And how are the staffing levels in the 911 center?
Good. We're not seeing any significant changes based on COVID at this point, but we are still monitoring everybody coming into the building before every shift.
All right, very good. Thank you.